Good afternoon, everybody, or good morning, depending on where you're watching us from. I'm Barbara Stilwell. I'm the Executive Director of the Nursing Now Global Campaign, which I certainly hope you've heard of, as you're tuning in to a seminar that we're very honored to be doing with Seed Global Health this afternoon, which is highlighting the contribution of nurses and midwives, not only to the pandemic, which is really taking all our attention at the moment, but very importantly, to all kinds of healthcare, some of which we know has been neglected in the last 6 months as people have struggled to contain the pandemic. But nurses and midwives have been essential to carrying on all the care that's been needed for everywhere around the world. So we're thrilled to be asked to participate in this important webinar, which we hope will be letting you know why it's so important to continue to invest in nursing and midwifery. We have a stellar lineup for you this afternoon. It hardly gets better than this. We're going to start by hearing from Sheila Tlou. Professor Tlou is an ex-Minister of Health from Botswana, a nurse. We're really proud she's one of the crowd of nurses who made it to be a minister. She's co-chair of the Nursing Now Global Campaign. She's also co-chair of the Global HIV Prevention Coalition and a former UNAIDS Regional Director. So we're thrilled that Sheila's going to be kicking us off this afternoon. Then we have some panels with Harriet Nayiga, who is a midwife, and she's director of the Midwife-Led Community Transformation in Uganda. And we know Harriet very well for a number of reasons. We're thrilled she can join us. And with her will be Rashid Salim, our other panelist, who's the chairperson of the Kenya Student and Novice Nurses and a real young activist. We're very proud that you're with us, Rashid. Thank you for that. Then we have Bongi Sibanda, who I know very well because she's an advanced nurse practitioner, and that is a subject dear to my own heart. And Bongi has a special focus on global health policy and has founded the Advanced Practice Nurse Coalition for Africa. Really important. And then we're joined on that same panel by Mary Augusta Fullah, who is the Chief Nursing and Midwifery Officer from Sierra Leone. Welcome, Mary Augusta. Really good to have you on this panel. And to close, none other than my esteemed colleague, Elizabeth Ero, the Chief Nursing Officer from the World Health Organization. We're very honored, Elizabeth. Thank you for joining us. So we have a number of partners for this important webinar. As I mentioned, Seed Global Health, Frontline Health Workers Coalition, the G4 Alliance, IntraHealth, and Partners in Health, and Smile Train. So there's a lot of people committed to this important webinar, for which they thank them. We thank them. But before we get started, I particularly want to thank Patricia Igesa from Seed Global Health, who has been wonderful in helping us set this up. So thank you so much, Patricia, from all of us. We couldn't do it without you. So I'm going to pass now to my colleague, Sheila, to kick us off, please, Sheila, with a rapid fire, a sort of highlight of the critical role.
All right, thank you very much. And good afternoon or good morning, everyone, wherever you are. As you already stated, I'm Sheila Tlou, and I consider myself a very passionate nurse. So I will start by thanking Barbara, but also congratulating my colleagues for putting up this webinar with Seed Global Health. and really saying that we're hoping that at the end of it all, we will be even more inspired to really tackle this very challenge that we are on, the COVID-19 pandemic. At no time has the spotlight of the world shone on nursing and midwifery than it is right now. So I want to pay tribute to nurses who have lost their lives through caring to this pandemic, and to really say that let's make sure that their legacy lives on, and let's continue to shine that light on the world to give hope. Let's also pay tribute to our nurses and midwives who are continuing to care. Some of them under very stressful conditions where they have lack of PPEs, personal protective equipment, and there's also nursing shortage, but they are continuing to care despite even that psychological, that psychological trauma to them of knowing that they could be infected. But not only that, they could actually take the infection home to their families. Some of them are elderly people who could easily then succumb to the disease. So we really acknowledge you, and we know that the world now recognizes the importance that the nurses are to us. Well, indeed, nurses and midwives are the frontline respondents under very stressful conditions most of the time, and very terrible shortages. As highlighted in our recent State of the World Nursing report, a lot of it has really to do with government investing in education. We are really showing through the State of the World Nursing report the shortages globally. And really the thing that we will not be able to reach universal health coverage without the proper education and training of more nurses. So our governments need to invest in education and training of nurses, in their work, in their career development, in their retention, through decent work, through decent pay, but most important, through ensuring that even at country level, nurses have their security and safety needs met. That is very important. Without that, we will continue to have the so-called brain drain, which indeed occurs in a lot of countries. Now, as nurses, we need to advocate for gender equality that our heads of state signed to and committed to as part of the Sustainable Development Goals, mainly because nursing and midwifery are professions that have more women. And therefore you find in that because of that, there are fewer of them in leadership positions. So we need to ensure that nurses and midwives are placed in leadership positions where they can be able to influence policy, where they can be able to really ensure that there is less corruption and resources are taken to where they are most needed. I have a good example of that. For me as a Minister of Health, being a nurse and really working with, knowing how to work with communities, I was able to just say, look, how do we ensure that we win the AIDS epidemic? And with the assistance and the help and really the work of nurses, we managed to bring down mother-to-child transmission of HIV from 29% to actually less than 8% within 8 years. No, within 4 years. But most important, and I'll show you something, when I was a minister, infant mortality rate was at 17 per thousand. And under 5 mortality rate was at like 36 per thousand. But 10 years later, after I left, various cadres were put in as ministers, and including a medical doctor. The infant mortality rate within those 10 years doubled, and the under 5 mortality rate doubled, showing that when she leaves, a lot of things do happen. So I want you to really take heed of the Nightingale Challenge and ensure that it is implemented in each and every one of our countries, because that's the only way we can have nurses and midwives being in those leadership positions where they can influence our change. Now, let me conclude by really stating that health is a political choice. And therefore, I urge us to advocate, but I urge our governments to involve, to invest in that political power and ensure that they engage nurses and midwives to achieve those 21st century health challenges that we are encountering right now. With that, with those few remarks, let me just say I am looking forward to all the ideas that you all have and offer you my support. Thank you very much.
Thank you so much, Sheila. That's absolutely great. You've really highlighted what we need to be thinking about this afternoon. How do we get political commitment to invest in the education and training of nurses? We're now going to have, you're going to have an opportunity, you who are listening, to do a poll, which I can't see on the screen. Is it up yet? Here we go. So you've got not long to vote, but please do vote. How many nurses, so it's a little quiz really, how many nurses are there per 10,000 people in Africa? So that's an average in Africa. How many nurses per 10,000 people? Click on your answer. And how many additional nurses and midwives do we need to achieve SDG 3 on health and well-being? So the SDGs have got to be achieved by 2030. If we're going to do that, how many more nurses are we going to need? So, have you voted? I'm going to give you the results, I hope, in a moment. Are we going to get the results up? Oh, here we go. Okay. So, 63% of you said 8.7 per 10,000 people, and you are correct. How many additional nurses? Well, State of the World's Nursing Report says we need an additional 9 million nurses to achieve the SDGs. So that's a big shout, isn't it? 9 million more nurses. And that leads us into our next panel. I'm going to ask Harriet to start, if you would, Harriet. We're going to look at the shortage of nurses. How does the shortage of nurses and midwives impact the services that can be delivered now at this moment with all the demands of COVID-19 and beyond as we aim to recover to be better and more resilient? How does the shortage impact that?
Well, thank you very much, Barbara. I want to thank the organizers of this panel, the Nursing Now Global, and also Seed Global Health in Uganda, which is helping nurses and midwives get up so that we can be seen. We really thank Seed Global Health for this initiative and also other partners in this. As I was introduced before, my name is Nayiga Harriet, a midwife from Uganda. I'm a director of Midwife-Led Community Transformation, MILCOT, which is a community-based organization in my community, Nansana, that is aiming at bridging the gap which is existing between the midwife and the local community through provision of sexual reproductive health to adolescents and young adults who are marginalized, and we also provide them with survival skills. And I'm also a young innovative midwife with Nursing Now Global and a young midwife leader with International Confederation of Midwives. Well, when we talk about the shortage of nurses and midwives, one may think that there is total lack of nurses and midwives, but it is not the case. We are actually in excess. That is something that I keep on wondering. We are in excess. When I look at the statistics, that Uganda has a total of 20,475 midwives, and that is a ratio of 1 midwife per 2,000 people. So that is a big discrepancy. And then when I look at the nurses and midwives who are graduating every year, over 6,000 nurses and midwives graduate every year, and 80% of these are coming from private institutions, and then 20% are coming from government institutions. But then also data shows that over 1,000 nurses and midwives are unemployed. But we are asking ourselves that, where are these nurses and midwives? Where are they with the evidence from WHO that tells us that we need more 9 million nurses and midwives to meet the global health coverage by 2030? So what can be done with these nurses and midwives? When I turn to training, I want to speak by giving my own example. I trained with a diploma in 2013 from a government institution, and that is Mulago School of Nursing and Midwifery. I was privileged and I studied on a government scholarship, which is something that I'm so proud of. Added with the award for the best practical midwife of the year 2013. And here it is. Here it is. It reads, Best Practical Midwife 2013, Nayiga Harriet, Mulago School of Nursing and Midwifery. This was given to me by the government. But I want to talk about where do we go after training, or even when we perform well, because that is an evidence that I'm performing a crucial role. For example, as per my case, with all my love for mothers and babies, the love I have for vulnerable communities. So I'm asking myself, would I meander around in a pool of very few, highly competitive and very cheap jobs after graduating? No, one would think that I would be consumed in the field to serve the country. But that wasn't the case. And I'm sure that many of my fellow nurses and midwives follow the same. When I discuss with my fellow nurses and midwives, especially those ones doing degree, and I ask them, when you finish to graduate, what's your plan? No one is sure of where she's going. No one. Because the money she has invested in education cannot be paid with a little salary that she will get. And so they always tell me that I will go outside the country and look for greener pastures. So that is loss of great resources from the nurses and midwives. And now when we look at this shortage, when we go to the health facilities and when we come down to the vulnerable communities, we would see nurses and midwives everywhere, but we do not see them. We do not see them. When we go to the hospitals, there is overcrowding of patients. Especially in Africa, all these effects are exaggerated. So I want to say in this panel that all times are crisis times. All times are crisis times. With an example of Uganda having a maternal mortality rate of 336 deaths per 100,000 live births before the pandemic. That means we had the crisis before, and now it is over-exaggerated by the pandemic. So what are we going to do? What are we going to do? And when you look at the effect of shortage of nurses and midwives during the crisis, when we have few nurses and midwives in hospitals, that means we are going to have dissatisfaction in health service delivery. Patients will not be attended to. We shall have low quality of services provided because we are seeing nurses and midwives on the front line. patients will not turn up for healthcare, for skilled healthcare services. They will go back. They will go back and be attended to by traditional birth attendants. And then we shall see nurses and midwives getting stressed. They will be stressed, and the patients are stressed. No one is helping the other because of attending to many patients. I myself, I have experienced this. So now, when
Harriet.
you come to the communities, we know that crises like this. Hello, Barbara?
Yes, hi. Thank you. We're coming towards the end of your time. Sorry, I didn't mean to interrupt you. I thought you'd come to a pause.
Okay.
But you've raised some really important points, Harriet, that I just want to pull out and emphasize. One of them is that we train more nurses and midwives than we employ, you know, in many countries, and that's critical. So where are they going? Are they migrating? Are they going to other jobs? Are they just not working? You know, those are critical questions. And the other really critical point you've raised is this isn't new. We're talking about, you know, this is not a new crisis. We've been short of nurses and midwives for years. And it's impacted on the care that we can give, which leads nurses and midwives to be stressed, which leads them to leave the profession. So, you know, you've raised these critical points. And Rashid, can I bring you in at this point? You're a learner, and I'd just like to ask you about this, about what you feel, if you feel there are some critical gaps in your education that you're experiencing in the midst of this pandemic as a learner. And can we better support learners so they learn what they need to and then stay in the profession? Where are you, Rashid? I can't see you.
I'm here. Thank you, Barbara.
Oh, there you are.
Hello to all the panelists and all the attendees. My name is Rashid Salim, like you've been told. I'm currently the chairperson for Kenya Student and Novice Nurses, which is a chapter under the National Nurses Association of Kenya. I'm also a young advocate in nursing with the Global Nursing Now campaign, as well as a participant in the Nightingale Challenge 2020. But now, what are the gaps that we experience as learners or as nurse learners, and more especially during this COVID-19 pandemic? We understand that nursing is a practical training. It's a job, it's a hands-on training that really needs us to be physically there. So we find that we've now moved to the digital platforms of learning, but that hasn't really worked well with the nursing students, because most of us, you know, especially those in the final years where we're just doing the practicals, we want to be in the wards. We haven't been supported well enough with PPEs, you know, with the support that we need, the mentorship to manage the patients and attend to our practical sessions. Other gaps that may not have really been, you know, due to COVID-19, but have been there before, is you find that nurses have been trained for the ward. So you find I'm concentrating on, you know, from the library to the clinical area, and I miss out on so many other opportunities, such that when I graduate, the only focus I have as a graduate is to go mostly to public health facilities to manage patients, forgetting that there are many other opportunities that coming up with projects that can help the communities, you know, joining NGOs where you can actually learn a lot more than just patient management. Another gap is you find that the clinical environment sometimes is not as friendly as you expect as a student. Maybe in the classroom, you've been really shown how interesting and how nice nursing can be. You go to the ward with you know, very high expectations of a very vibrant, a very nice profession. But when you get there, the people that you get there, especially those that are not clinical instructors, they want to bring you down. For lack of a better word, they don't want to hold your hand and show you the way. So, for instance, if I came in with a lot of enthusiasm, you know, in doing the nursing care plans, and I find a clinical nurse who knows how the shifts are, and they're scarce. Of course, the human resource is scarce, and they tell you, you know what, we tried this, but it never worked. So don't bring in something new that it's just not going to work. So we find an environment that is not that enabling for us to put down what we've come from classroom to the practical side. What we can do to support the young nurses and the students, and not only in nursing, but across the professions, one is to improve the investment in the, in the education sector. As a student, I want to see, maybe I want to have a lot of exchange programs. I remember when I was a student leader in the University of Nairobi somewhere in 2018, one of my campaign strategy was that I'll bring in exchange programs so that people have to, go abroad and see what others experience, and then the others will fly in. But then you find there's that hurdle of it all needs resources, and these resources are scarce. So we were not supported to do the exchange program. So we asked for the governments and any other well-wishers to invest more in education. And it's not only about trips. It all goes to even the skills labs that we train in. If a skills lab is not as equipped as I would expect, then I'll miss out on some of the practical aspects that I may need to. Having enough trainers and enough clinical instructors is part of the investment in the nursing department. Two, governments need to establish robust and functional nursing departments or directorate of nursing, because it's only when you have someone who has been through the profession or someone who knows how the profession is that they can be able to lobby for more support and more more support towards nursing. So you find that some of the governments, they actually have a directorate of nursing that is not functional. We find the functions of nursing being played by other departments, or like doctors and other healthcare workers that are managing issues to do with nursing. We can also mentor those in practice. You find that, for instance, maybe me, I'm interested in leadership, and I've gone to conferences and I've seen the insight. I've really been, opened up to see, wow, this is how the world looks. When I come back home and I find those in the leadership positions, maybe I've been in a conference that I've been told, go to your Department of Nursing, go to your registrar at the Nursing Council and see how you can work together. But when I get home, sorry to use this, but let me use leader A. Leader A is not able to accept my support or my initiative or my interest in being a leader. So currently, I really appreciate the Nursing Now Global campaign and the Nightingale Challenge that are really focusing on raising the profile of nurses by empowering the future generation. But we're forgetting a very vital component of nursing, those already in practice. Because I've been mentored, yes, but when I come to the field, I'm meeting a very hostile environment that I may never practice what I was mentored to do. So let's not only focus on the mentorship of young nurses, but let's also focus those mentoring those already in practice for us to have, a harmonious succession of leadership and progression from education into practice. Thank you so much, Barbara, and all the panelists and all the attendees.
Thank you, Rashid, so much. That's a wonderful, it's a wonderful way to sort of end this little bit. Because I think you identify an issue that even when I was a young nurse, and goodness knows that's a long time ago, but when I was a young nurse, we always had, this education practice gap. So you came out as a young nurse into practice, and everybody said, no, don't do it that way. We've always done it this way. This is the way to do it. So it's about valuing what our young, new qualified nurses bring, as well as our students, and valuing their potential as leaders and giving them opportunities. And that's one way we can keep nurses in the profession. So Rashid, thank you. We're going to have another poll now, and I would ask you also, if you have questions, can you put them in the chat box for us? And we will answer them in a little while after our next panel. But first we have some questions. Here we go. Just like last time, answer them. Women make up a majority of the health workforce. What percentage of leadership roles within the health system do they hold? Okay, so women make up actually 70% of the health workforce. So given that, what percentage of leadership roles do they hold? And then more than what percentage of nurses work in countries that are home to half the world's population? So a percentage of nurses work in countries that are home to half the world's population. What percent? Okay. So, do we have any answers? Aha, okay. So, women make up 70% of the health workforce, and they actually hold 25% of leadership roles, and that many of you answered 15%, and I can understand why you feel despair like that. And then more than what percent of nurses work in countries that are home to half the world's population? It's more than 80% of nurses work in countries that are home to half the world's population, and that is significant because we know there's currently a shortage of 5.3 million nurses, 5.9 million nurses, but of that 5.9 million shortage, 5.3 million are shortages in low and middle income countries. And that's why these numbers are very important, because they, you know, everybody works in countries which are wealthy, and we have disproportionate shortages in countries where there are already health system challenges. So I'd now like to introduce our second panel, and the first speaker there is now for us is going to be Bongi Sibanda. And Bongi, in your experience, why are there so few nurses and midwives in leadership positions? And do you think the development of advanced nursing practice and specialist nurses is important and is going to influence leadership in nursing?
Thank you, Barbara. May I start by thanking the panel and thanking SID Global and Nursing Now for hosting this session today. Many thanks to our participants who have joined us too. I'll first start by sending our condolences and thinking about our colleagues who have lost their lives and paid the ultimate price while serving in the COVID-19 pandemic. And as we continue to serve during this pandemic, and with a possible rise of a second phase of this pandemic, I would like to really stress on some of the important areas around leadership. First, by answering your question on leadership, Barbara, why do we have so many gaps and yet very few nurses in leadership positions? I think the answer that is so multifactorial. There is no single answer to it. But on top of it, it really has been the lack of value of nurses and understanding of what nursing education is and how it has moved on the years. Very few healthcare executives understand that nurse leaders at the moment now may have MBAs, may have MPH, and they may have so much influence in health policy. But we also know that even though the nursing workforce is the largest health workforce globally, and it's the women who are actually more in this workforce, those leadership positions that are rare and that are open for nurses are also led by men. And that is even clear on the document Delivered by Women, Led by Men, published last year. I'll give an example of, for instance, in Africa, where you have more men who are in nursing than in any other areas. So we've got about 30% of men who are nurses. Even though they are 30%, the majority of leadership positions there are held by men, not by women. So women still are left behind on gender equality. And there's also has been a tradition of unclear progression of nursing in nursing career. if I ask a newly qualified medical student today what they want to do, they are clear whether they want to be a family physician, whether they want to be a medical consultant. There is a clear pathway for that. We still do not have that in nursing, and where it exists is very fragmented. So, which means that it's a hit and miss to have leadership positions. There hasn't been investment in education, as highlighted, education and leadership and mentorship of nurses in leadership as well. And that's a global issue, and that's a global problem. Regionally, we do not have leadership structures just like our medical colleagues do. Yes, we now very much have our WHO chief nurse, which we are so elated to have. But it's impossible for her to oversee the regions as well as one chief nurse. So on that note, I'm really still advocating for a regional WHO chief nurse for every region, particularly for Africa. I know that in Europe we're on the pipeline for this, but for Africa, because I have seen what it means not to have a leader at regional level to coordinate the health policy at regional and sub-regional levels, and as well as for us to see the implementation of the State of the World Nursing recommendations. We'll certainly need to have that leadership at regional level. So with regards to advanced practice nursing, which comprises of nurse practitioners and clinical nurse specialists, well, from a global point of view. But if you were to ask me differently, Dr. Stilwell, I'll also add advanced practice midwifery and nurse anesthetist from an African and American perspective. So to stick with the two, really, the two APN roles are critical. Not only do they fulfill the four key areas, clinical practice, research, leadership, and education to advance nursing, but we know that nurse practitioners and clinical nurse specialists consistently provide high quality patient-centered care to communities, especially those that are usually vulnerable, those that are hard to reach, those that are in the rural areas. And they continue to bridge the gap that Rashid was talking about of research, academic practice, and clinical practice. The APNs are very much well placed to bridge that gap. And we know from the countries that have implemented nurse practitioners or advanced practice role that this gap has been minimized and is producing important patient outcomes. If we think about what has been also going on with the COVID-19 pandemic, we know that nurse practitioners and clinical nurse specialists stepped up to take leadership roles. They were redeployed to areas where they were involved in education, particularly critical care outreach. They were involved in telehealth. They were involved in academic practice. They continue to support students as well in academic practice virtually. So they play a very key role and a very important role. They are very well placed to lead interprofessional teams alongside medical colleagues. So collaboration really is one of the key areas that APNs are very well placed to lead on and to advance interprofessional education. We have also seen through COVID-19 the gaps of leadership that exist, especially in nursing. Some countries have acted more swift than others. In the UK, we know that care homes and social care had a real severe impact of COVID-19. And it's been really exciting to see the government take a very strategic view last week with the promise to appoint a chief nurse for adult social care in the UK. And that's really is going to be a pivotal role that will ensure that we have clinical leadership in social care. And we hope that other countries will also follow suit, invest in nursing leadership, invest in education, And as well, when setting up these roles where there is a new chief nurse, that it is the office of the chief nurse. It's not just one person appointed, but a number of people also to support them. Otherwise, they won't be able to fulfill these roles. So really, those are some of the issues around leadership.
Thank you, Bongi. Thank you so much. And you're absolutely right. It's not only in nursing, but I think nursing is particularly affected by appointing nurse leaders without a team and with no money. And that's what we heard in our survey of nurses globally, you know, that many of them said, we get appointed, but we don't have the resources to do a good job. So I think that is absolutely critical. And I also endorse we hope, the new appointment of a chief nurse for health and social care here in the UK will make a big difference, I think. Thank you, Bongi. I want to bring in Mary Augusta from Sierra Leone and ask you, Mary, you're on the ground, you're actually doing the job of a chief nurse. What are your key strategies for retaining nurses and midwives in their professions and in their communities? How do you do it?
Thank you very much. I want to thank the organizers and the participants of this conspicuous meeting. I am Mary Fullah, the Chief Nursing Officer in Sierra Leone, Chief Nursing and Midwifery Officer in Sierra Leone. To keep our nurses at their various communities to reach areas, we have to have an enabling environment in these areas, and that includes the housing. Imagine you are taking somebody from a city and you want them to work in the far end of the country where you have thatch houses and you expect that person to be living in a thatch house. So the government should make sure, first of all, that in all those areas where they have healthcare facilities and they expect nurses to be posted to these facilities, there must be provision for housing for these nurses. And communication link, when you have to leave your families and to go to these hard to reach areas, to go to these communities that are far off from the cities. So we have to ensure that communication link is improved. So that is not only done by governments, can be done by partners, by the telecommunication people, to ensure that the communication spreads out throughout the country, so that our nurses will be encouraged to stay, because wherever they will be, they can get in contact with their own families and continue to be close together through communication. We talk about the equipment as well. If you have a health facility far in the community and you have all your equipment that will enable you perform your duties perfectly, that will encourage you to stay in that facility. But if you have a facility where you don't even have blood pressure machines, which is obvious in some of our facilities, then what are you finding there as a midwife or as a nurse? Because that is one of our instruments that we use to tell the condition of our patients. So you need equipment that will enable you to perform to your satisfaction, because in nursing, what I know, it's a satisfying job. You have at the end of the day to be satisfied saying, yes, I did the right thing for that patient, no matter the outcome. And then transportation. We have some communities that are hard to reach. In fact, you have to take like Honda bikes or even bicycles to go to these communities. Some nurses are now fat enough that they will not even be able to sit on motorbikes. And we have accidents. Nurses have been accidents when using motorbikes to go to these far away communities. Some of them have lost their legs. One happened last year here in Freetown, in one of our communities. She was brought to emergency and she lost one leg because of the fracture. So all these things will not encourage the nurse to stay in far away countries, communities where they work. Sometimes they will have to move up and down. And again, if they have just young families coming up, it will be difficult for them to leave that family to move to the far away communities. The pay structure. Imagine you have to pay extra, like on transport to go to your workplace and so forth, and the salary structure remains the same. There's no allowance for remote areas. So we need remote allowances for nurses who are living in this far to reach areas where they are making sacrifices for the people of the countries. And the retirement benefits and packages. Nurses sometimes, you know, we need this type of comfort to know at the end of the day, when you are retired, you have something to take home to take care of yourself. If not your children, because they might have grown and gone to their own different families, but you need to take care of yourself. So you must have a package that will be encouraging, and that will encourage you to stay on the job. If not, like somebody said, attrition. If I know they are paying me 1, 2, 3 million leones at the end of the day, it's not enough for me. It's not enough for me to put aside. Then I will move to somewhere else, to another country. So attrition will come in. And there must be in the workplace, because nurses and midwives, we are working within a setup of other healthcare workers. There must be a clear job description within the healthcare service workforce, that everybody should be doing what they are supposed to be doing. Presently, like the matrons, I can remember when we were nurses, matrons had the sole authority in the hospital set up, and they call them, this is my hospital, or this is my theater. But presently we have what they call hospital manager, we have what they call hospital secretary, we have human resource people, and the roles are overlapping, and this is bringing confusion and dissatisfaction. Now nurses hardly take control or commands directly from matron. They will say, the secretary said, the human resource said. So there is that overlapping that is really bringing in confusion and dissatisfaction among nurses and midwives. We talk about the medical insurance. Sometimes we, like in COVID situation, or when we had the Ebola, some people lost their lives. Did they get any medical insurance? No, it is now that government is really trying to work on this, but we need that, because even when you have accidents or anything in the field, there's nothing to cover you. You have to take care of your own bills. You have to take care of everything for your own self. So we need that medical insurance that will ensure us to stay on the job, because we are sure of the future.
Thank you, Mary. You have really shown us that what we need is a multi-sectoral approach to creating an enabling environment for nurses and midwives. And that's what's going to attract them to the profession and keep them in the profession. They have to have the equipment, they have to have transport, housing, education for their children, and their own medical care. And it's very good to ground us in those really what seem almost common sense, but it's amazing how often those things are missing for nurses and midwives globally, and no wonder that they leave the profession. So we're getting close to the end. We've got about 9 minutes. We've got one question in here that I'm going to ask Sheila. Are you still with us, Sheila? It's about advocacy, the vital role of advocacy. And somebody's commented, Pat Dowse has commented, there must be greater advocacy and stronger voices.
Yes.
Sheila, yes. In a couple of minutes, do you have a comment on that?
What was the question?
It was about advocacy. Nurses need stronger voices and better advocacy.
Okay. Well, you know, I'll tell you, when we were being educated, training, we were always told that nursing is apolitical. And that was so wrongly interpreted. Apolitical meant you did not have to involve yourself with any one political party. But definitely, everything about nursing is very political. So that we need to, therefore, at country level, align ourselves, for example, with members of parliament. There should be that member of parliament who particularly listens to the pleas of nurses, so that at parliament they're able to then speak. So it can be a nurse. I usually say to nurses, join politics. it's not as bad as you think. So that you are then able to speak knowing, firsthand what the nurses experience. But other than that, it's always great to then align yourself with a member of parliament, because you then have a voice that speaks for you exactly where the highest decisions are being made. So that's the advocacy. The advocacy would then be the Nurses Association, the Nurses Forum, ensuring that that voice can reach the highest level, either through somebody or through they themselves. It's really that, but advocacy is needed in every aspect of nursing. Thank you very much.
Thank you, Sheila. Thank you so much, and very wise. I know from my own experience in this campaign, you have to choose your friends wisely
Yes.
and get them to advocate for you. So we're rapidly running out of time. We've had a really action-packed webinar. So I'm going to ask Elizabeth if you will give us a sort of few closing remarks, a sort of high-level final 5 minutes, Elizabeth, to reflect on what we've been hearing from your global position. And you'll have to
Barbara, thank you very much. And likewise, I want to also extend my appreciation to the Nursing Now group and also to the Seed Global Health for this webinar. And also especially to our people that were on the panel. I think from Sheila right through to our last speaker, to Mary. It's been a fantastic panel, and to hear your voices and to hear your experiences that you've shared. So I think for me, first of all, I do pay respect and understand the impact that COVID-19 has had on the world, the central role of nurses in the midst of caring and treating patients affected by the virus, and how that's demonstrated globally and recognized respect of nurses, and highlighting really the importance of our profession. It's brought to attention some of the challenges, as mentioned by our panelists today, the gaps, challenges identified in the State of the World's Nursing Report. But I also want to still pay tribute to the nurses and healthcare workers who have been infected and those who have died as a result of the COVID-19. I think interestingly, I just want to highlight what I gathered from the summary of the discussions today is some key things on investment. Now, investment in nursing and midwifery means investing in the future of healthcare. But as Mary mentioned, investing also means ensuring a safe working environment, a safe environment, and an environment that is resourced so that we can do our job. The education and employment of nurses and midwives will be critical to the resilience of health systems. I think we should not be naive about how this is operationalized. And I think our panelists today has highlighted some of these challenges. It is a complex agenda because there are always competing values, there are competing objectives, there's political, and there's also professional agendas. And we need to understand all of this within the context of our individual country that we work in. So the State of the World's Nursing Report has provided us with the data and the evidence. The next iteration of the State of the World's Midwifery Report 2021 will add to that data and the evidence. So I think it's really important to consider that this is not just a nursing agenda, this is also a political agenda. We know nurses are a critical member of a multidisciplinary team, and the education and training programs must produce nurse graduates who can work in an interprofessional teams. This could mean working in remote setting, primary healthcare and communities, and connecting digitally across the health and social care services or in clinical settings. And this can mean working under a nurse-led primary healthcare model of care. I think Pumi's interventions on advanced nursing practice is bridging the gap in this regard. So these are all very important when considering education curricula and competencies. Some of the other elements that was teased out of the interventions presented today was on migration and the mobility of nurses. So additionally, the mobility of nurses can add to unequal distribution of nurses. In 2020, around one nurse out of every 8 practices, out of 8 practices in a different country that they were born or trained, with the migration often happening from lower income to higher income countries. Many high income countries are too reliant on nurses from other countries because they themselves have too few nursing graduates. So we've heard the oversupply of nurse graduates in Harriet's intervention today. So I think this is a critical consideration for all countries. So countries with a shortage should invest in graduates and the retention of schemes. The countries losing many of the nurses through immigration need to consider how best to retain those nurses, such as through improved salaries, working conditions, and professional development opportunities. I think these were elements that was teased out of the interventions I heard in this session today. I think the leadership issue came across very, very strongly. Investing in nursing leadership and governance is vital in strengthening the nursing workforce as a whole. We know that the presence of government chief nursing officers or their equivalent positions and the existence of a nursing leadership program are associated with a strong regulatory environment for nursing. This is an evidence that we have found in the State of the World's Nursing Report. So establishing and supporting the role of senior nurses in government, as well as offering leadership programs to nurture leadership development in young nurses is the key. And Rashid alluded to this. And so we know there are 70% of countries with a GCNMO, with a chief nursing or midwifery officer, but not all have the function and the responsibilities as a nurse leader and are engaging in policy decisions. But this is the element. We need to have these teams to support. We need to have a budget to support, to enable the difference we seek for. So it's not just a position. We need this person to be functioning. And so, you know, a couple of our panelists alluded to this. Now, for policy dialogue, moving forward, I think the WHO is currently working with partners to support countries in taking forward their priority nursing agenda as a follow-up on the State of the World's Nursing Report through a policy dialogue. The State of the World's Nursing Report was never meant to be just a report. Some have called it a roadmap. It was conceptualized as being a tool through which data was collected, aggregated, and returned to countries in support of evidence-based decision-making. The report, therefore, is embedded within a theory of change, which sees data as being part of a continuum that is followed by dialogue, which will lead to decision-making and result in investment and address real need because it's based on evidence. So that's where we're heading to in terms of supporting and strengthening nursing and midwifery in countries. However, I have to say, with the challenges of the COVID-19, we have engaged really at this stage with those countries who have indicated a readiness to progress on this matter. So my call out today would be, if you're in a position to initiate the discussion on policy and take forward some of the recommendations of the State of the World's Nursing Report with specific relevance to your country, priority needs, please let me know. We would like to engage till we get to a stage where we can roll out this, by region. The other additional next step forward for us in terms of taking forward some of the issues raised today is the progress on the iteration of the next strategic direction for Strengthening Nursing and Midwifery 2021 to 2025. This will be a key document to support countries, as I said, in strengthening nursing and midwifery workforce and monitor and account for their progress in implementation. The issues we have discussed, such as the shortage and distribution of midwives and nurses, challenges around education, leadership, scope, working conditions and environments, and issues that COVID-19 has highlighted will be key elements we can take a deep dive into this process. The findings from the State of the Rules of Nursing and the upcoming State of the Rules of Midwifery report, as well as the input from hundreds of stakeholders at our recent Triad meeting and GCNMO forum in June, will be important contributions also to the discussions and the consultation processes. So just as a reminder, these were some of the top 10 policy issues that were highlighted by the Triad meeting. And they were, elements that were spoken about education, about leadership, about data, about practice, about jobs and regulations. So in conclusion, I want to say that COVID-19 has shown us the courage, compassion, expertise, and the resilience of midwives and nurses. We, the global nursing and midwifery communities, need to ensure the narrative accurately reflects the achievements, the lessons learned, and the influence of change and investment needed to strengthen health systems through investment in midwives and nurses. A continued collaboration is needed beyond 2020. Governments and state leaders need to transfer their accolades and praise of nurses and midwives through this COVID-19 pandemic into investment actions that will impact positively on the profession and future-proof health systems. The failures and gaps exposed by COVID-19 in our health systems can be addressed, and I call on domestic and international donor partners to invest in our health workforce and specifically to the nursing and midwifery workforce. With the opportunity of the International Year of the Nurse and the Midwife, and in the time of COVID-19, if there was ever a time to make changes and investment in nurses and midwives for long-term health system sustainability and resilience, that time is now. Thank you, Barbara.
Thank you so much, Elizabeth. That was very awe-inspiring and a real rallying cry for all of us. Nursing and midwifery are best buys in healthcare. And we need to be putting that business case on the table to the politicians, the policymakers, the money holders. Investing in nursing is an investment because you'll get a big return on your investment. We could have gone on for twice as long, I think, if with this wonderful panel. Yes. But we've had some great messages. We've got one final poll that I will ask. We've still got 104 participants who've stayed on the line. So if we can put up the final poll, it's about how would you invest? What call to action are you committed to? We can't vote on it, but will you please vote? Increasing funding for education training, investing in jobs, nurturing leadership, or advocacy. If you're like me, you probably want all of them, but choose one. Where are you going to put your top investment to strengthen nursing and midwifery as we move towards the post-COVID resilient world, we hope? Do we have those results? Here we go. Advocate for and enforce supportive policies, 48%. So it's fairly, leadership development 43 and increased funding 36. So probably a lot of people like me feel we probably should do all of those things. But somebody had put in one of our Q&A boxes that what we need to do is to get, actually it was in the chat box, I think, get nurses, let's pull up our seats. It's from Rashid, who says, let's pull up our seats to the policy making table. This is our Rashid, I believe. and what we do in our current positions is not about literal pull. So we have to learn how to be at those policy tables, making our case, and as Elizabeth says, using the data that we now have for the first time. So I want to thank you all, wonderful panelists and speakers. You've all been fantastic. And if I could give you a big round of applause, I would.
Yay.
Thank you so much.
A virtual one, a virtual one.
Yeah, virtual one. And thank you to Seed for hosting us. It's been a wonderful webinar. Here's to the next time.
See you next time.
See you
Bye.
next time.
See you everyone.
Yes.